Hey everybody, Dr. Drew Ferris here. I wanted to talk to you about a question that I get every day from parents, and it's this: why do I see 7 and 8-year-olds running around town with braces on? Isn't that too early? Don't they still have a lot of baby teeth left? Isn't that aggressive? It doesn't really make sense. And so I wanted to answer that. The two things to note is one, the American Association of Orthodontics recommends that every child between the ages 7 and 8 be seen by an orthodontist. And two, that's something that I always recommend in my office as well, and there's a good reason for it. It used to be that we just wait till kids were, say, in high school until we looked at them orthodontically, because at that point all their adult teeth were in. The problem with that approach is that a lot of patients were getting their adult teeth extracted if there was crowding or if there were bite issues. We were treating too late, we weren't benefiting from their growth, and ultimately we just weren't taking care of our growing patients like we should. So luckily now we have an option, which is a first phase of treatment. What I tell parents is that in the first phase of treatment, it's basically there's a short list of reasons why we would do it. Two reasons are if there's something bite related, like say a crossbite where the upper teeth fit inside the lower, that can actually affect growth moving forward and can create skeletal asymmetries that then lead to surgery down the road. So we always want to take care of that at an early age. Second is if there's just a lot of crowding that we can see on our 3D x-ray, we can treat that at an early age to make space, and then therefore we can avoid things like extractions down the road. I want to show you what was traditionally done and why we don't do it anymore, but this is a situation where this guy's 10 years old, he comes into the office, and what you'll see is in the corners here, he's supposed to have a primary or a baby tooth canine in each one of those corners. But his dentist took those out thinking that it would make space for him for the adult teeth to come in. The problem is it just creates a path of least resistance for new teeth to come in, but it doesn't gain an overall net amount of space because we're not changing the perimeter, and therefore now this little guy is basically condemned to having extractions because you can see that where these canines are, they virtually have no path to come in, and to further that, they can start pushing on the actual lateral incisor, which is the adult tooth, and treating it like a baby tooth. And if that happens, they can actually push that out and cause you to lose your front teeth. So the nice thing about what we can do in a first phase of treatment is we make room. So we create a bigger perimeter, and then therefore we can have a lane for those teeth to come in. This prevents 3 potential big risks. One is the tooth becomes impacted and eventually you have to surgically go get it. 2, it can prevent having to take out good adult teeth down the road, which is really beneficial now that we have studies about airway and different systemic things. Extractions aren't good for that, so we don't want to extract adult teeth if we can avoid it. And the third is the resorption that I showed you here, where it can actually damage the adjacent good adult teeth. So here's what it actually should look like. Instead of taking out good adult teeth because we see crowding, what we want to do is a patient like this comes in at the age of, this girl is 6 years, 10 months, so we started at the age of 7. What we did is you can see from an aesthetic standpoint, it looks great because we were able to align the front adult teeth. But during that, we also made space for the rest of the teeth to come in by gaining arch width or gaining space. And so therefore you can see on the top where these teeth were completely overlapping and blocked out and had no room to come in. And then within 1 short year, you can see that both of these teeth now have a lane to come in, and we've prevented all of those big risks that I just talked about. Same within this situation too. So came in at the age of 8, and within 1 year she was treated. What I would definitely recommend is that every one of your children be seen at the age of 7 or 8. And like I said, the majority of your children won't need treatment at this young age, but the ones that do, it minimizes so many risks down the road that it would be very beneficial to do that. So if you're curious, at my practices, we have one in Santa Barbara, one in Goleta. At both of them, we offer complimentary consultations, so feel free to look us up at ferrisorthogroup.com, and I'd be happy to take a look and see if there'd be a need for that.